Alrighty. Good afternoon, everyone. I am so glad that you're here to join me for Diabetes 101. My name is Shannon Parks. I am a registered dietitian by trade and your on-site health coach through UMR. Before joining the county to serve all of the employee population and your families, I have worked as a clinical dietitian in a local large hospital system, counseling patients on diabetes really often. Diabetes impacts many, many people and may even impact you or someone that you know. So I'm really glad that you're here to learn more today about the condition. Please keep in mind that the information shared in today's presentation is educational in nature and is not a substitute for professional medical advice. For specific questions, please contact your in-network provider. With that, let's go ahead and get started. I want to encourage you to utilize the chat throughout today's presentation should you have any questions. That way we can circle back to the questions at the end. I do intend to leave some time at the end of today's presentation to go over your questions. So for today's agenda, we're going to cover a lot of information in a short time, but don't worry, this presentation is being recorded. So if you want to watch it again as you continue to learn about diabetes, it'll be available for you. We are going to take a close look at what diabetes is, the common signs and symptoms that lead to diagnosis. We'll discuss some treatment options, complications from a lack of proper treatment, and most importantly, prevention of developing diabetes. So first, let's start with talking about what diabetes is. Diabetes is a chronic medical condition that is characterized by elevated blood sugar, also called blood glucose. You'll see that we use those two words interchangeably throughout today's presentation. But the medical condition is characterized by elevated blood sugar or blood glucose levels and the body's inability to make or effectively use a hormone called insulin to bring those blood sugar levels back down and to make the blood sugar usable by the body. As I explain to a lot of my patients, when we eat a food or drink a beverage that contains carbohydrates, which is going to be things like fruit juice, grains like rices and breads and pastas, cereals, snack foods, and starchy vegetables like potatoes, peas, or corn, what happens is our blood sugar levels start to rise naturally as we digest and process what we've consumed. And as our blood sugar levels start to rise, our pancreas, an organ in your abdomen, kicks on and delivers a hormone called insulin. Now, insulin has two main jobs. The first job is to shuttle those blood sugar or blood glucose molecules from the bloodstream to the muscles, acting like a key that unlocks the muscle cells to be able to receive that blood sugar and make it usable as energy within the cell. And as the blood sugar leaves the bloodstream and goes into the cell, insulin is effectively lowering our blood glucose level and putting that blood glucose to use. The second job that insulin has is to shuttle any leftover blood sugar after the cells have reached their capacity of what they can handle in that one sitting off. It shuttles all the leftover glucose to the liver where it's packaged and ultimately stored as body fat. When an individual has pre-diabetes or maybe even full-blown diabetes, there are difficulties with insulin regulating blood sugar. Either the body has stopped producing insulin, or the insulin being produced is not as effective as it once was for a number of reasons that we're going to get into later today. Diabetes affects an estimated 38.4 million people in the United States alone, and medical costs tally $413 billion annually for treatment of and lost wages due to diabetes. Interestingly, 1 in 3 American adults has prediabetes, And more than 8 out of 10 people with prediabetes don't know that they have it. Furthermore, 90 to 95% of all diabetic cases are type 2 diabetes, which is preventable. So let's learn more together about the signs and symptoms to watch out for. So the onset of diabetes can be signaled by a handful of signs and symptoms, with different individuals having a range of different experiences with their own signs and symptoms. Commonly, signs of diabetes can include things like excess urination, called polyuria, which is noted by urinating more frequently than your normal, which is a cause of high blood sugar levels. You can also experience excess thirst, called polydipsia, which is signaled by a seemingly constant sensation of thirst or compulsive water drinking, often triggered by high blood sugar levels that are causing increased urination, signaling the body to replete those fluids. Weight loss can also be an early sign of diabetes, as the body starts using body fat and muscle tissues as energy because glucose can't get into the cells and therefore causing weight loss. Dehydration can also be a sign of developing diabetes, and it can be caused by the increased urination and water loss as a result of high blood sugar and the impacts on kidney function overall. Excessive hunger or excessive fatigue can also be signs of development. Chronically elevated blood sugar levels contributes to feeling hungry more often, as well as feeling sleepy and fatigued. And lastly, blurry vision can demonstrate that blood sugar levels are frequently high, and this can worsen into vision impairment or even blindness if blood sugar levels remain high and start damaging the microscopic blood vessels within our eyes. So let's talk about diagnosis here. So due to prediabetes and type 2 diabetes both coming on more gradually, which may or may not be easy to see, you may or may not have pretty blatant symptoms, the American Diabetes Association recommends the following people be screened for diabetes. So your screening for diabetes is going to be for individuals whose BMI is over 25, regardless of age, with an additional risk factor, including high blood pressure, elevated cholesterol levels, or a physically inactive lifestyle, or a history of polycystic ovarian syndrome, or heart disease, and lastly, or having a family history of diabetes. So you can see it's not just about the elevated A1C or the elevated BMI, it's about having these other conditions as well. They also recommend anybody older than the age of 35 get screened. Pregnant individuals who have had gestational diabetes before are also recommended to be screened. Anyone who has been diagnosed with prediabetes should be screened. And there are a number of tests that your doctor might conduct to determine if you have diabetes. There are also common physical symptoms that can lead to diagnosis. So on the screen on the right or the left-hand side rather, you see some of the tests that your doctor might run. A fasting blood glucose. That means that they would take your blood labs before you had anything to eat or drink that morning outside of water. And a diagnosis of diabetes can come if your fasting blood glucose is higher than 126 milligrams per deciliter. You could also have a test called a random plasma glucose, where they would pull your blood sugar level at random. And if your result was higher than 200 milligrams per deciliter, that could be indicative of diabetes. And lastly, having an A1C level of 6.5% or higher. Now, A1C is a measure of your average blood glucose over the last 90 days. You can also be at more risk if you have family history, and that could lead to diagnosis. And then there are a handful of physical signs and symptoms beyond what we discussed on an earlier slide. Things like feeling really sleepy after a meal, especially a carbohydrate-rich meal. Having skin tags, acanthosis nigricans, which is a dark or velvety skin around the neck or folds of the body, like the pelvis, the underarms, the bends of the elbows. Craving carbohydrates or fatigue, even with a good night's sleep. So if you have any of those, you may consider being screened for diabetes if you're not already being screened. So there are a few different types of diabetes to consider when discussing this condition. There's type 1 diabetes, which accounts for roughly 5% of all cases. And then there's pre-diabetes that demonstrates that someone may be at risk for developing type 2 diabetes. There's type 2 diabetes in and of itself. And then lastly, there's gestational diabetes, which impacts pregnant individuals with elevated blood sugar levels. So let's look at each of those individually. So the three main types of diabetes are type 1, which is formerly called juvenile onset diabetes and is now often called insulin-dependent diabetes. And that's due to the onset typically being in childhood, somewhere between the age of 9 and 12. There's type 2 diabetes, which was formerly called adult onset diabetes or non-insulin dependent diabetes, as it's typically diagnosed in adults. And then there's gestational diabetes that impacts pregnant individuals with elevated blood glucose levels. So type 1 diabetes is a chronic medical condition that leaves an individual insulin dependent for their entire lives. Their bodies don't make insulin or don't make enough insulin to metabolize the foods that that person consumes. Insulin is a hormone that the body produces to allow blood sugar to enter the cells and be used as energy. And when the body doesn't make insulin, glucose levels get dangerously high, which makes that individual dependent on injecting insulin to manage their blood sugar levels. At the present time, there is no known cure for type 1 diabetes. Type 2 diabetes happens when the body can't use insulin correctly and blood sugar levels build up within the blood. This can be caused by a poor diet, physical inactivity, vitamin or mineral deficiencies, certain medications, stress, hormonal changes, or genetics. And oftentimes, type 2 diabetes is treated with a change in lifestyle factors, as well as possibly diabetic medications or insulin as needed. Lastly, gestational diabetes occurs when the body can't produce enough insulin to meet the increased demands during pregnancy, leading to elevated blood sugar levels. This condition typically develops around 24 to 28 weeks gestation. And pregnant individuals are tested around this many weeks gestation, as sometimes gestational diabetes may not cause noticeable symptoms. So any individuals on here who have had children know about that glucose drink. It's not great, but it is really effective at testing to determine if you have gestational diabetes, which can lead to an increased risk of your child developing diabetes as well. So what are high blood sugar levels anyways? High blood sugar levels, also known as hyperglycemia, can pose serious health risks for individuals with diabetes, type 1, type 2, gestational, or prediabetes, and it's crucial to manage them effectively to prevent any and all complications. So hyperglycemia happens when there's too much glucose in the bloodstream, typically due to not enough insulin being produced or administered, or due to insulin resistance, which is a condition where your body doesn't effectively use insulin to lower blood sugar as it should. So both insulin and blood glucose build up in the bloodstream. So for diabetics, ideally, the fasting blood glucose is 130 milligrams per deciliter or less. That's for someone who's been diagnosed with any form of diabetes. For a healthy individual, it would be 100 milligrams per deciliter or less. And then 2 hours after eating for a diabetic, we're looking for their blood sugar to be 180 milligrams per deciliter or less. And for a healthy individual, typically within 2 hours after eating, their blood sugar should have come down to what it was before they ate. So let's talk about what causes high blood sugar levels. Hyperglycemia usually doesn't cause symptoms until blood sugar levels are high, which is about or above 180 to 200 milligrams per deciliter. Symptoms of hyperglycemia develop slowly or can develop over several days or even weeks. The longer blood sugar levels stay high, the more serious symptoms may become. But some people who have had diabetes for a long time may not show any symptoms despite high blood sugar levels. So the early signs and symptoms of high blood sugar are that frequent urination we talked about, increased thirst, blurred vision, feeling weak or unusually tired. And if hyperglycemia isn't treated, it can cause toxic acids called ketones that build up in the blood urine. And this can cause something called diabetic ketoacidosis, which is a emergency situation and the individual needs to go to the hospital. That would be come with signs and symptoms like a fruity smelling breath, dry mouth, abdominal pain, nausea or vomiting, shortness of breath, confusion, or loss of consciousness. But what causes high blood sugar levels? So it can be caused by high intake of simple carbohydrates. So white flour products, sweets and treats, sweetened beverages, etc. It can be caused by physical inactivity or not enough physical activity on a regular basis. Illness or stress can cause blood sugar levels to go high. Can also be a cause of medication side effects or issues with medication, maybe not finding the right dose of anti-diabetic medications, or perhaps if someone is on a steroidal medication, that can cause elevated blood sugar levels as well. Or lastly, the body may not be producing enough insulin, or you may be insulin resistant. All of these things can contribute to high blood sugar levels. So what should your ideal blood sugar level be? And we talked about this a little bit, but fasting glucose less than 130, ideally somewhere between 80 and 130, 2 hours after a meal, less than 180. Recommended blood sugar levels can help you determine whether your blood sugar is in a normal range or not. However, your blood sugar target level may vary from the general recommendations as defined by your physician, of course, relative to your overall health, your age, the presence of other health conditions known as comorbidities, the length of time that you've had diabetes. A doctor or a healthcare professional will help you determine your target range based on your health and medical history. So the numbers listed here are the recommended blood sugar range for adults with type 1 and type 2 diabetes and children with type 2 diabetes. Okay, let's keep going. So when should you test your blood sugar? There are, and I didn't list this on the screen, but there are two different ways to test your blood sugar. One of those ways is with a finger stick. So you see that over here on the top right hand of the screen, you have these little diabetic test strips. And you have a glucometer here. So you use a small lancet needle to prick the finger, collect some blood on the diabetic test strip, and then you enter that strip into your machine and it gives you a reading of what your blood sugar is. There's also something called a continuous glucometer or CGM. And you may have seen these on individuals. Maybe you knew what they were, maybe you didn't. It's a little white circle the size of about a quarter, maybe a $50, that's typically placed on the back of the upper arm. And this measures blood sugar levels minute by minute, and they correlate with a Bluetooth app on someone's cellular device so that they can see what their blood sugar levels are in real time. The benefit to this is sometimes when we do a finger stick, we might think that we're getting a reading that shows, our high after a meal, but it may be still rising and we don't know it. Or we might think that we're getting a low after a meal, but it may be still declining and we don't know it. Whereas a CGM creates a graph based on minute by minute readings that you can see in real time what your blood sugar is doing. Careful monitoring of blood sugar and knowing what may cause it to rise or fall can help you and your health team develop a diabetes care plan and set treatment goals. Additionally, measuring your blood sugar can help us monitor how medications are impacting your blood sugar levels, determine how different meals and food choices impact your blood sugar, determine whether exercise or other lifestyle changes are impacting your blood sugar levels, helps you keep track of your overall progress. And even if you don't have diabetes, it's a good idea to get your blood sugar levels checked periodically. A doctor might order a blood sugar test as a part of your annual physical or biometrics. And if you have any risk factors for diabetes, you may need to get your blood sugar checked more often. I will say on the county's biometrics, you do have the option of checking a box to have your A1C tested. I always recommend it. It's just a good number to have to understand where you fall over the last 90 days versus just a single day snapshot. So if you are testing your blood sugar, you want to do it when you first wake up for fasting levels, and then before meals, 2 hours after a meal, and then before or after exercise. The reason for this is we want to know before meals where we're at, so that we can test 2 hours later and see if we've administered enough insulin and our blood sugar has returned to a more normal state. And then before or after exercise, we want to make sure that if we have a borderline low blood sugar, that we fuel either on either side of exercise when it comes to diabetics, because their muscles burn our muscles burn that glucose, so that exercise can cause a diabetic low. So let's look at what type of diet you should eat as a diabetic. Diabetes diet simply means eating the healthiest foods in moderate amounts and sticking to regular meal times. It's a healthy eating plan that's naturally rich in nutrients and low in fat and calories. The key elements of a healthy eating plan for a diabetic are fruits, vegetables, and whole grains. In fact, this type of diet is the best eating plan for most anyone. The plan helps you control your blood sugar, manage your weight, and control heart disease risk factors. These factors include high blood pressure and high blood fats like triglycerides or cholesterol. When you eat extra calories and carbohydrates, your blood sugar levels will rise. And if blood sugar isn't controlled, it can lead to serious problems. You can help keep your blood sugar level in a safe range by making healthy food choices and tracking your eating habits. So looking for healthy carbohydrates, fruits and vegetables, whole grains, legumes, and dairy, staying away from the processed foods that maybe it's harder to control our portions of, looking at fiber-rich foods such as produce, nuts, legumes, seeds, and whole grains, incorporating healthy fats like avocados, nuts and seeds, olives, and healthy oils. So Greg just asked in the chat, what are legumes? Great question. Thank you for asking that. Legumes are going to be similar to beans, like lentils. Peanuts are technically a legume. So they're in the bean family. Anything except for a green bean, we can consider a legume. And then healthy oils are going to be avocado oil, olive oil, ghee, which is butter that has had the milk fat strained out of it, and coconut oil. And then we want to limit our added sugar for obvious reasons, as they impact our blood sugar levels, our unhealthy fats, and our processed foods. I think it's important to go over common complications of diabetes as well. So left untreated or unmanaged, diabetes can cause a host of complications as the disease progresses. In the initial phases of poor diabetes management, an individual may experience elevated cholesterol levels, and this is because elevated blood sugar levels upset the balance between good HDL cholesterol and bad LDL cholesterol, and can even raise triglyceride levels or can cause damage to arteries, making them stiffen or harden, which can contribute to development of cardiovascular disease, namely increasing the risk of heart attack and stroke. While blood sugar levels are high, inflammation is also high, and damage is being caused to blood vessels, especially the tiny blood vessels that run through our kidneys, our eyes, our brain, and our hands and feet. The damage often progresses slowly but can lead to severely painful symptoms. Kidney damage can turn into kidney disease, requiring dialysis. Vessels in the eyes can become damaged, causing loss of eyesight or retinopathy or even blindness. And the blood vessels that carry blood and oxygen to your extremities can also become damaged, leading to a tingling sensation diagnosed as peripheral neuropathy. I did leave this off the slide, but more recent research has told us that elevated blood sugar levels can also contribute to the development of Alzheimer's dementia. And so you may have heard recent kind of sayings that dementia is type 3 diabetes, and that's because of that impact on the blood vessels of the brain. So can diabetes be prevented? I think this is a great question, right? And the answer is yes. However, it takes a lot of work for a lot of people, right? And the internet will tell you it can't go into remission, but I have seen it go into remission as far as prediabetes and type 2 diabetes. Prediabetes, type 2 diabetes, and gestational diabetes can all be prevented and possibly reversed. To achieve remission or prevention of development of diabetes, it's important to closely examine your nutrition intake to promote more whole foods, lean proteins, and whole grains, with a reduction in processed foods, especially ultra-processed foods, which is all the stuff that comes in packages and boxes with ingredients that we don't know what they are, and added sugars. Eating a healthful diet will help contribute to having a healthy body weight, which also reduces the risk of developing diabetes. Even a 5% weight reduction can reduce your risk. Participating in regular exercise, defined as sustained elevated heart rate for a prolonged amount of time, doing repetitive action, is important for promoting good blood sugar control. Glucose, or blood sugar, is the #1 fuel source for our muscles. So the more regularly that we exercise, the more efficiently our body uses that blood sugar and the less insulin our body needs to produce. Lastly, being sure to complete your annual wellness exam with your physician, including lab work, is going to help catch any differences year over year sooner than you might see symptoms, allowing you to take swift action towards lifestyle changes or medical intervention as necessary. So, if you're diagnosed with diabetes, what kind of medication will you need? There are several medical treatments available for diabetes. For type 1 diabetics, insulin will always be required. There are two main types of insulin: long-acting, which covers blood sugar levels for 12 to 24 hours. That's also called basal insulin or base insulin, and short-acting, which is also called bolus insulin, that covers blood sugar levels for the meal or snack ahead. Most type 1 diabetics take a combination of long-acting basal insulin and short-acting bolus insulin. For prediabetes and type 2 diabetics, oral anti-diabetic medications are the common first-line treatment. Common medication prescribed is metformin or glipizide, though there are others on the market that work to reduce an individual's blood glucose levels throughout the day. And that might have to be taken once a day or twice a day. Lastly, there are injectable medications such as GLP-1 drugs that help control an individual's blood sugar levels. Ozempic and Mounjaro are brand name GLP-1 medications directed for treating diabetes and aiding in weight management.